It's the Blue Collar Breakdown! Welcome to the Blue Collar Breakdown! Starting right now!
Yeah, starting right now. Okay, welcome to the Blue Collar Breakdown podcast. I'm Tom Eddlem, your blue collar economist. Today we're going to talk about healthcare and how the economy is rigged. It's episode 27 by my count. Make sure you like, you share, and you subscribe. Also, you can support the podcast by clicking the link on the show notes page and buying me a coffee. And we had our first supporter for the podcast. I say we, the plural we. No, I don't have a tapeworm, and no, I'm not pregnant. I had the first supporter actually help me out, and I thank you. You wanted to remain anonymous, and I will allow that. But I know who you are, and you're much appreciated. Also, another show note before I get started into the content, make sure you check out the Libertarian Institute, for which I write on a regular basis. I have a piece in the hopper. I don't know when they're going to run it. Probably right soon after the first of the year, about the Trump breakup, the if you will, the MAGA breakup after basically Trump gave up on all of his promises. If you watch the last if you watch the last podcast, you know Donald Trump campaigned on being the peace president, that he would end wars. And if you have paid attention to even the last week, he has become the president of war, bombing 9 countries this year, including just a couple this week, including Nigeria and Somalia, and on and on. So make sure that you look at the previous podcast. But today I want to talk a little bit about healthcare and how the economy is rigged against working people in healthcare. This is a kind of a complex topic. There's no one thing I can point to. It's like, this is why it's rigged. There are a whole series of things that rig the economy against the working person when it comes to the healthcare industry. And it's all government driven. Again, this is the third in my series of how the economy, third podcast in my series of how the economy is rigged against you. We covered war the last time. Before that, we covered we covered the war two episodes ago, and the real estate and financial industry last time. And what the basic theme of it is this, that when two people trade freely in an open market, in a free market that's not manipulated by anyone, they both get richer. And if you look at the world economy over the last few centuries, the countries that have had freer trade and fewer restrictions on commerce have tended to get richer. However, once you introduce government into the equation, you introduce force. And generally speaking, what that means is one person in the trade is going to get richer and one is going to get poorer. And as a result, society doesn't advance. And that's what we have in the case of healthcare in America, just as we do in finance and in the war munitions industry. Okay, so why is that? Well, let's start with a few basics. First of all, the average price of healthcare for a family plan. So picture, a young family in their 30s. They've got, it's the husband, the wife, 2 kids. They have average health. They go into the market to buy a healthcare plan, whether directly or through their employer. And between them and their employer, they pay, on average, $27,000 a year. Well, think about it. That is more than $500,000 over 20 years. All right. And when you think about it, well, gee, would they use that much on average? When someone said to me, well, you think, okay, what do they do in an average year? Well, they probably have 4 or 5, between the 4 people, they probably have 4 or 5 visits to the doctor for the flu. They get antibiotics. There's probably a sprained or broken ankle or knee or wrist. So there might be an MRI in there. None of that is anywhere close. And then someone said to me, well, what if the mom has to have a baby? Well, that shouldn't be close either to $25,000. It actually is getting pretty close to that. But one of the things about America today is moms aren't having a lot of babies. The average family now is less than two, husband, wife, and two kids. So there's, even if they had a baby every year, they probably still wouldn't use up all of that money they're putting into into their health insurance program, and that doesn't count deductibles and all the rest of it. Okay, so we've got the very high cost, and a lot of people, especially on the left, they point to, the United States pays about double what other advanced countries pay for healthcare. And one of the points they make is, if you look, the U.S. pays on average $12,000 per person. And if you look, the United Kingdom is only $5,500. And, the richest one is Switzerland, and they're still only $8,000. So we're still 50% more than Switzerland, the next highest country. And of course, the solution that the leftists come up with is, well, we need a socialized medicine. Look, it's going to cost us less. And it is. And of course, one of the other problems that the socialists point out is this, that we have worse health outcomes because now defenders of the free market will say, well, that's because we're fatter. We eat more. We have, fat, overweight people have more health issues. They're more likely to get cancer. They're more likely to get heart disease. They're more likely to get all kinds of ailments, and that's all true. But even if you factor in the obesity levels, it still doesn't make up the difference. Yeah, our obesity levels are not, more than double what they are in Europe. Okay, except for maybe France. France and Italy are probably have the lowest obesity rates among advanced economies, but almost all the other countries, we're ahead of them by a substantial margin, but it's not double, and that's not the problem. Okay, so what is the problem? Well, a part of it is government regulates the economy. Like, one of the things, if you look at, say, for example, life insurance companies can charge you more if you're a smoker. In other words, the choices you make, if they're unhealthy, cost you more in the market. All right, because the life insurance companies will probably, if you're a heavy smoker, you have to pay out more. That's not the case with health companies. Like, you could be 300 pounds, you could be, all of these. They don't consider a lot of these factors, and they're not allowed to in many instances. So that's something that prevents costs from going down rather than up. But first, before I go into this, I want to talk a little bit about the history of healthcare in America, because traditionally we had a free market in America, and we had a market that had a safety net for the sick and the poor. And if you look at the history, one of the great quotes by the English essayist G.K. Chesterton was, "Other than a church," and I'm not quoting it, I'm paraphrasing it. He said, "Other than a church, there is no more natural building to be built by a Christian than a hospital." And if you go back to the Middle Ages, the churches built the hospitals all around Christendom. In fact, the oldest surviving hospital in Europe is a hospital in England, built by the Church of England. Well, at the time it was in the 1300s, so at the time it was the Catholic Church, but it was a Church of England. And in America, the same thing happened. If you look at it, I'm coming from the Boston area. If you look at the major hospitals in the Boston area, they're almost all religious, founded by religious orders. They're major hospitals like New England Baptist, Beth Israel Deaconess. Now, Beth Israel was a Jewish hospital, and Deaconess was a Methodist hospital, and they merged. Okay, there was one of the hospitals I go to is a Catholic one called Good Samaritan. I mean, you can go right across the board, even going right back to the beginning. I mean, Harvard Medical School. Harvard started as a school for pastors, and then they added the medical school. Okay, and now they have links with all the local hospitals. Even when they started health insurance in America, they created what was called Blue Cross Blue Shield, and the Blue Cross was for the hospitals because the hospitals were most likely to be Christian. And let me get this down here. I don't need this up anymore. The Blue Shield was for the physician side of things, the individual, this physician in individual practice. And the change in that is one of the big changes in pricing in America. One of the things that, all right, before I go into this, one of the things I did was, just for fun, I went on to ChatGTP, okay? And ChatGTP basically lies to you all the time on behalf of the establishment. I was looking at, okay, I wonder, I know Trump had bombed Syria back in February of this year, and ChatGTP swore up and down that it never did that until I pointed out a story to them. Then they said, "Oh yeah, that's true. Yeah, we were wrong." I mean, they do that all the time. And here's one of the things I did was I pulled up a story. Let me see if I get the right one here. No, that's not the one I want. Okay, I think this is it. Okay. Nope, that's the conclusion later after I argued with them. Maybe ChatGTP on healthcare. Let's see. Let me try this. Okay, I had to argue with them. Their first response was, gee, the markets have really raised prices. And then after a little bit of arguing, ChatGPT came out with a one-sentence conclusion. Government rules do raise U.S. healthcare prices, mainly by restricting entry and encouraging consolidation, but they explain only a minority of access costs. Provider market power and price setting explain far more. And of course, even after arguing them, they're like, why do they have market power? Because government regulations give them that market power. And let's go a little bit into this, because the market power is a big thing. A lot of local networks basically run the show, and local hospitals run the show. There is a big barrier to entry for hospitals. There has to be a need. There has to be what is it called? I wrote it down here. It's called a certificate of need. Certificate of need laws prevent the building of new hospitals. And what happens is hospitals get to basically charge whatever they want. And there's people are just, they don't have a choice. Now, for most healthcare, that doesn't matter. But what has happened is there has been this tendency for hospitals to go in and buy up local practices. So let's say your doctor is in a practice with another doctor. Well, the hospital could come in and buy them up. And typically what happens is the fees go way up. And here's one of the things that what ChatGTP revealed to me. Okay. And again, I would not take the numbers seriously because I don't believe anything out of GTP, but they do explain the basic phenomenon here, or at least with their help, I will explain it to you. All right. Let's say you go to the doctor says, all right, it's $150 for the visit. Maybe they charge you $25. They charge your insurance company $125. So that's how it works. Well, what happens is when the hospital takes over the practice, then they can charge a hospital agency facility fee. You're not going to your doctor. You're going to the hospital, even if it's the same office that you're going to before. Now the hospital can charge the hospital facility fee. And oftentimes that's several multiples higher. and there's no competition. There just isn't, and the insurance companies just pay it and they charge you more, or they charge your employer more, and that's how it works. That's one of the ways it happens. Now, this is not the market forces in action, because everything is restricted. I mean, doctors are licensed by the government. The FDA drugs are licensed by the government. All the patents for all of the drugs are monopolized by the government. And I'm going to go into that when I do an episode on Big Pharma. I'm going to go into that more detailed. You've got the certificate of need laws. You've got also Medicare facility fees. What happens is we have a weird system in the United States where the healthcare system, the private healthcare system, is subsidizing the public healthcare system. So what happens is Medicare goes in and they negotiate a low rate. The hospital loses money on the Medicare rate, so they charge more for the private funds. Now, part of that is BS because of the hospital rate inflation through buying up local practices, through a whole bunch of things. The best way to explain it is this. A lot of people look at their costs. A lot of businesses, most businesses in the free market, probably all the businesses in the free market, look at their costs and they say, okay, this is how much our costs are. We need to make this much profit minimum. So cost plus the profit, that's our price. That's not the way hospitals work. They say, how much can we get? Okay, we can get this much. Well, our costs are this much. Well, that means we have to spend equal to our costs. That way it looks like, gee, we're charitable organizations. We're always on the verge. So what they do is the administrators make good money. They have all these extra facilities that they really don't need, and they can charge more to their patients. And this is what happens. It's sort of the opposite of a market-based system. We have, in a technical sense, medical fascism. And I know that's a hot term. When I say fascism, you think Adolf Hitler and, the Nazi salute and all that stuff. That's not what I'm talking about. What I'm talking about is the corporations and government in bed together. Okay, that's what I mean when I say fascism. The corporations and government are like this. They subsidize and regulate each other. They support each other politically. The corporations support the government politically. The politicians support the best way to. I made a meme. I don't know if I showed it in one of the previous ones, but this is kind of how it works, right? For those of you guys listening, not seeing it, you've got a woman who's a taxpayer, and there's a pickpocket taking money out of his pocket, and it's trillions of dollars, and it goes to the government. And the government's getting pickpocketed by billionaires and corporations, and it's taking billions out of the government's pocket. And the politicians are taking millions they're picking the pocket of the billionaires and corporations and taking millions out of their pocket in the form of campaign donations and friendly ads. And that's basically how the system works. Okay. But in healthcare, that's the racket. I mean, they raise the prices as much as they can. The hospitals do, and the health insurance companies just kind of pass it on, and they are kind of a monopoly too. So they try to maximize their profits, and within the regulations that they're allowed. The whole thing is full blown cronyism. Okay, let's see. One thing to point out is that costs for healthcare shouldn't be going up; they should be going down as a general rule. And one example to point to is those healthcare costs that are not covered by insurance tend to be decreasing. And there aren't too many of them, but there are a few. And one of the guys who likes to point this out is Senator Rand Paul, because he used to be an ophthalmologist, or maybe he still is. And he points out that, LASIK surgery has gone down in price. And indeed it has. So I again, skepticism with the exact numbers here with ChatGPT, because I I asked him to tell me what the price of silver and gold are today, and they got it wrong by a factor of 50%. So there you go. But the fact is that LASIK surgery has gotten cheaper. In some cases, more so than is represented here. But if you look at the numbers, back in the late 80s, when it first came out, it was about $4,000 per eye. And that's like $7,500 per eye, for today, if you adjust it for the CPI. However, today, the cost is, $1,200, $2,400. Actually, I know there's a lot of places that will do LASIK surgery for less than $1,000 an eye. And again, that's a cut by half and then a cut by half again, the price for the surgery, because technology makes things cheaper, not more expensive. And it should work that way. It works that way with other electronics, right? When we look at the price of television sets, when we look at the price of computers, when we look at the price of, phones aren't really coming down, but if you don't get the latest Apple, you could still get a really nice phone for $200 online if you go to Amazon and you look for a brand new iPhone that's a couple years out of date, or a brand new Motorola that's a couple years out of date or made for a third world market, that you can get a really nice phone for a couple $100. And so those prices have been coming down. All the tech prices are coming down, and yet they charge more. Here's one of the other things I wanted to point out too, and I meant to point it out a little bit earlier. It's that when an insurance company is involved, it's going to be more. When a hospital is involved, it's going to be more. And you can look at the variety in costs, or the difference in costs in some of these things. I'm trying to wrap this up here because I don't want to go too long. I'm already a little bit over time. But how much does an MRI cost? You sprain your wrist, you sprain your ankle. You got to go in and get an MRI. How much does it cost? Well, it depends. It could cost as little as $400, or it could cost $12,000, depending on where you live and what body part you want and where you go. And the $400 to $12,000 is almost entirely covered in just the Miami area. If you go to Miami, if you go to certain hospitals, it can be up to $12,000. And it can be as low as $400 at private centers. And a good part of that difference, by the way, is what body part you're scanning. An MRI on the chest is more expensive always than an MRI on a wrist or an ankle. But the price varies by a factor of 7 or more just in the city of Miami. All right, depending on where you go. And a lot of people, almost everybody, doesn't care. You don't care what the MRI costs, even though it's the same MRI machine or whatever, because, hey, what does the network recommend? I'll just go where I'm told. And if it costs 5 times as much or 7 times as much or 9 times as much, oh, well, the insurance company's covering it. But that's one of the factors here, that there is no incentive to economize. There's no incentive. There's no law of supply and demand, because there's supply and there's demand, but there's no incentive whatsoever. There's no price mechanism. It's all destroyed by regulation through the government. And it wasn't in the past. Healthcare at one point was getting cheaper unless it was like a new technology. You think about when aspirin first came out, it got cheaper and cheaper, and a lot of these things, and think about a lot of these drugs as they become generic, they get a lot cheaper, and then pretty soon they're not just a lot cheaper, they're dirt cheap, right? Especially if they're no longer required, a prescription is no longer required. If they go to over the counter, super cheap. Well, it's especially the case with things like an MRI. So this is why the system is rigged against you. It's rigged to help insurance companies, middlemen, to help politicians. When Obama won his mandate back in 2008, he had a mandate to have some socialism, a little bit of socialism, to have what he called a public option. He never got it through. Why? Because billionaires control both sides of Congress. And what came out of the legislation was worse than what we had before. It increased costs for consumers even more than it did before. Now, he talked about it as a cost-saving thing, but obviously it didn't work. It didn't save any money. Healthcare costs continued to go up by double digits from 2008 right up to today, and it continues apace and probably will be until the foreseeable future, until we either have completely socialized medicine or we roll back some of these regulations. And I'd recommend the latter. Okay, that's about it for today. I'll have another episode for you, and this will be, I'm thinking of doing a bonus episode in the middle about some fun things, but I will have another episode on this, how the economy is rigged against you. I have 6 or 7 of these total, and this is only the third. So we'll keep going with this. And as always, I ask you, be free and like, share, subscribe. Bye.
The Federal Reserve Bank is the evil stank on America. Stank on America. Inflation is the billionaire's tax on working folks. It taxes everything from those who have nothing, and nothing from those who have everything. The rich people's wealth it stokes, while the poor it chokes. The Federal Reserve Bank is the evil stank on America. Stank on America. Inflation is the billionaire's tax on working folks. It taxes everything from those who have nothing, and nothing from those who have everything. The rich people's wealth it stokes, while the poor it chokes. The